Hey guys, yesterday we did a full arch maxilla guided surgery and some orthodontic surgery on the mandible. Patient is here today for a quick checkup because she lives out of town. And Dr. Salama is here, so I want him to come and check the patient. The patient is completely happy. Very little pain, if any, actually. She's just on Advil and Tylenol. She's super excited about the look, so I want you guys to see it with me, and let's go get Dr. Salama. So what surgery did you do yesterday?
We did a full mouth extraction of hopeless teeth. We had to reduce bone to allow us to have space for the prosthesis, as well as to reposition the gum, which she had excessive, what we call maxillary dysplasia, excessive display of her upper jaw. She had too much bone, so the gums were showing in excess when she smiled, which made that display of gingiva look very poor from an aesthetic standpoint. So we took that down. We placed in 6 implants that were computer guided by Dr. Tadros and his team. The guides fit. Everything was done under precision and in a very safe environment with our anesthesiologist under general anesthesia, Dr. Ding. On the lower, we, in order for her upper jaw was wider than her lower jaw, so she had a lot of skeletal dysplasias that made this case very, very daunting and challenging. Dr. Tadros wanted my group, from an orthodontic standpoint, to be able to attempt to expand the position of the teeth in the lower to accommodate the position of the new upper prosthesis. So we have to make the parts fit, the top and bottom have to fit together. So what we did is do something called PAOO. It's periodontally accelerated osteogenic orthodontics. It's a lot of words, but what it means is basically when we make, again, computer guided cuts in the bone, just very thin. We do it without even opening a surgical flap, without stitches. It's all computer guided, and what we do is we stimulate the bone to expedite tooth movement. It's called a RAP phenomenon, rapid acceleratory phenomenon, which means that we get to the bone through these computer guided cuts in the guide that is provided for me, and the procedure was actually done in 15 or 20 minutes. Like I said, no sutures, no big incisions and things like that. So now in a few weeks we're going to give her an expander appliance, and we're going to slowly expand her teeth utilizing that surgery to expedite the tooth movement so that the top and bottom can then fit together. How are we doing today?
Good.
You doing all right? It's not that long ago that you were in the surgical room with me.
Yeah.
So this is 12 hours later. We're delighted by how you responded, but I want you to know that the planning was exactly what we did on the computer, was exactly what we ended up doing in your mouth. So the precision of the work that was accomplished was identical, almost to the 100th percentile. Whenever something like that happens and it goes well, the whole team is happy, obviously, because in the end, we want a patient who is going to get what they envision as the final outcome.
Definitely.
So you can take a look now what we were talking about earlier. She had maxillary excess, which means that her upper jaw was longer than what would be ideal or average. And by taking the bone up a little bit and the gum, when she smiles, she shows a healthy complement of teeth. Dr. Tadros now has the ideal width of the smile that focuses. If you look at her eyes, it actually is as wide as the pupils in her eyes. The midline is right down the center of her face, and the cant that she had beforehand is now even with her pupillary line. We're keeping the bottom teeth. We're not going to remove them. We're going to keep them healthy. We're going to reposition them in a better occlusal position so that the function of her jaw will be better, and she'll be able to chew and smile and enjoy life even better than she did before, hopefully. Is it what you expected?
Oh yeah. Yeah. Well, I thought it was gonna be like way more, like I'm good today, you know? Well, my mouth was so bad anyways, anything would have been. This is amazing though, yeah.
We're really happy for you. Marco, that's as good as it gets. Outstanding.